this could be depression. And I talked to, it wasn't just me looking at DSM-5. I talked to my colleagues, and George, who he's here right now, he's one of my colleagues. Him talking to me, and you're going to get me emotional, but it helped.
So George was sort of your therapist during
He was my therapist.
Welcome to your daily health briefing. I'm Dr. Albert Takem. This show is here to help you navigate the complex U.S. medical system, one step at a time. Whether you are decoding a new diagnosis, fighting for a referral, or just trying to stay informed, you are in the right place. Let's get into the science. We often assume that therapists, doctors, and other professionals should have all the answers. But what happens when the person trained to help others is the one who needs help themselves? In this episode, Alan opens up about his own depression after losing his father, and we talk about why even professionals need other people to guide them through pain. Have you had a patient where you had to share your own mental health struggle with to convince them to acknowledge yours?
Yes, absolutely. Absolutely. I've done that many times, where it also helps build rapport and trust when you're sharing your own personal experiences with a patient, where they may say something, or if there's a teenager, for example, that talks about some of the issues they're having as a teenager, and then I share, when I was a teenager, I had to deal with the same thing. I understand exactly what you're going through. Or an adult, you do try to find common ground to where, the patient can identify with you as the clinician.
Do you have a specific example you can share that somebody watching can learn from?
Sure. I'll use depression as, I've dealt with depression in my life. And I think when I've talked about that, I've talked about what are some of the triggers to that? What are some of the triggers that could be to depression? And some of those triggers, I lost my father recently. That was a trigger for me. And I remember there was a patient that was talking to me about just losing his wife recently. He was extremely depressed because he lost his wife, and I think he lost his brother. His brother has cancer right now. So his brother's on hospice, his younger brother. So he will probably be gone soon. And then he lost his wife a year ago. So I shared with him the loss of my father and how that affected me in terms of depression and anxiety. And so he was able to really connect with me, because he was like, oh, wow. Again, they see us as Superman, so they don't realize that you have personal issues too. Like, wow, you can really identify with me. And what I noticed is that he had a wall up before I told him that. For therapy, he had a wall up. He didn't want to really do it. He was doing it, and then something just clicked.
Doing it out of obligation.
Yeah, he was more doing it out of obligation. But after I shared that with him, something just clicked in with us in our relationship. And he's very, very, very into therapy now. And he will not let me miss a session. Okay? So I thought that was actually, can't remember the word I'm looking for, but it was a turning point in our relationship.
So that, let me touch on something you mentioned. How long ago did your dad die?
My dad died 2 years ago.
2 years ago?
Yes.
And then, so your depression started after your dad passed? Yes.
I may have dealt with it off and on over the years, but I think it definitely escalated.
So this was like the straw that broke the camel's back?
Yes, I think so.
Okay. So because sometimes I struggle with some patients of mine who have lost a loved one, and I'm not too sure if it's just prolonged bereavement or have they gone into depression.
Yes.
So how did you recognize that you were in depression and you were not just
bereaved? Right. Well, if we want to be technical about it, we have a manual that's called the DSM-5. The DSM-5 will outline duration of time, severity, and so on. So what we do is when we do different diagnoses, we go into that, we look at what the duration is, compare everything, and then that's how we come to the diagnosis. I think with mine, when I looked at I actually looked at the DSM-5 for myself. I was like, am I depressed or is this bereavement? And when I
You
looked,
had to be your own therapist.
yes. When I looked at everything, I thought it was depression. So I think it was a combination of that. Like you said, the straw that broke the camel's back. It was issues I was dealing with prior that I was ignoring and not and just pretending like it didn't exist.
And you were the highest echelon of mental health therapists.
Yes.
But you were ignoring your symptoms.
Ignoring the symptoms, which goes back to why I said therapists and doctors and need to be in therapy, because sometimes you're missing it. I didn't recognize it until Dad passed and recognized that this is not just bereavement. There's more going on here. And then was able to see that this could be depression. And I talked to, it wasn't just me looking at DSM-5. I talked to my colleagues, and George, who he's here right now, he's one of my colleagues. Him talking to me, and you're going to get me emotional, but it helped.
So George was sort of your therapist during
He was my therapist.
So,
but I didn't recognize certain things. Him being a clinician helped me. Even though I'm the highest level, he helped me recognize, and not just George, there were other important people in my life that helped me understand what I was going through. But I realized that I needed help. And I had access to clinicians and important people in my life that did help me.
So how did that make you feel, being the highest echelon of therapists and needing help?
Well, it reiterated what I already know theoretically, that we all need to get help. It doesn't matter what listen, mental illness doesn't care what your credentials are. Any illness that you know, doc, any illness doesn't care if I have diabetes, doesn't care if I have a PhD or not. It's what's happening inside the mind. It's what's happening, and it has to be dealt with. It has to be dealt with appropriately if we're going to have a better quality of life. And so, me being at the highest level, I still recognize now that I also need help. And there's also things that I might not see it. Just because I'm a therapist, I may not see it. It was individuals like George and others that pointed it out to me and say, hey, you might want to look at this. You might want to consider this. This could be what's happening. So it was really a learning thing for me, and it helps me in dealing with my patients.
It's amazing how you can get so close to the tree that you lose sight of the forest.
Right.
Because I remember, it reminds me of when I was taking lisinopril for blood pressure. So it's back in 2013. And I got up someday and my lips were swollen. My tongue was swollen. And, you would think a doctor, I would know right away that's angioedema. I was like, why do my lips feel funny? Like numb, and I made nothing of it, went to the hospital. And one of my buddies sees me in the physician lounge. It's like, dude, what's wrong with your mouth? I'm like, what? It's like, your lips are swollen. And I went to the mirror in the bathroom, like, oh my God. I said, wait, why are my lips swollen? And it hit me that angioedema, idiot. I'm taking lisinopril.
Right.
And it can cause angioedema, and that's one of the only reasons why you generally stop the medicine. But I bet you, if somebody had walked into the emergency room and I had seen him, and I looked at his chart, he was taking lisinopril, right away off the bat, I would have said, that is angioedema. But when it happened to me, I was the last person to know what it was.
Wow, interesting. Yeah, it's right to what we've been talking about. Yeah.
So I think, there is a huge parallel to that. And it reminds me a lot that, I mentioned earlier about, there was another time which I went to see a psychologist. This was back in I think I was a resident at the time. I was dealing with some immigration issues. And so I had to see a psychologist as part of the process. And I started chatting with him, and he asked me some questions. about my childhood, my mom, and I started crying like a baby. And I think he was taken aback, but not for too long because that's his job.
Right.
He knows what questions to ask. And I did not know how much stuff that happened to my mother affected me and how I had repressed a lot of pain and, just mental suffering until that moment. And like every other black man, not every other black man, there's some who are better at this than us, but
Yes.
I had buried it in a place where I never visited it until he brought it up.
Exactly.
And since then, I've not been the same. I've had to deal with the emotional trauma of all those things.
Yes. Yes.
So and it was hard.
Yes.
For me as a doctor
Yes.
who's supposed to be the one telling other people what to do, to not have answers.
Yes. Yes, absolutely. Absolutely.
So it is a huge burden, and I appreciate you for telling your story. So let me go back to that. How did you deal with it? You being a clinical mental health therapist, having to seek help and find help from other therapists. Did it make you feel less accomplished?
Did it hurt my pride? Is what
Did
you're
it hurt?
what
Yes,
you're asking.
exactly. I was trying to say it in a nice way. Did it hurt your pride?
I think it did. If I'm being honest, it did at first. But with the training that I have, I know that it's necessary. It is helpful, and it was. And as I started to uncover things, as you mentioned in your experience, there's a lot of things I started uncovering that I just didn't even realize it was there. Things from my childhood and so on and so forth that was affecting me. Then I saw the value of it. And of course, I already know the value of it because I've seen patients turn their life around. So my pride was a little hurt at first, but I got over that pretty quickly. And, I want to be an example to others with this. So that's why kudos to you. I just appreciate you really bringing this really important subject to life on this podcast. Very important.
No amount of training, education, or professional success makes someone immune to depression, grief, or anxiety. Mental health does not care about credentials, and sometimes the person who helps everyone else also needs someone to sit with them, listen, and help them see what they cannot see for themselves. This has been the Daily Brief. Medicine is not about certainty. It is about responsibility. Decisions are often made with incomplete information, but they are always made with your safety in mind. In a system that can feel rushed and fragmented, you deserve clarity, continuity, and an advocate who sees the whole picture. I am Dr. Albert Takem, your physician ally, high-level science, human-level care. I will see you at the next briefing, or I will see you in the clinic.